Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. And before we start the program, I'd like to remind our listeners of our programming change for the Chiropractic Corner. We've moved to a new time. We're now on Friday mornings at 9 a.m. right after the Dick Farrell Show, and then again Saturday morning at 10 a.m. Please join us at those new times for the Chiropractic Corner. Now let's get on with this week's show. If you remember, in the last couple of shows, we had a discussion about functional medicine, as we've talked about what functional medicine is and how it differs from conventional Western medicine. We talked about some of the considerations functional medicine practitioners go through when they're evaluating a patient. Doc, would you give us a brief synopsis of what functional medicine is and how it differs from conventional Western medicine for our listeners this week?
Okay, here's a quick review. Functional medicine, also known as lifestyle medicine, engages both the patient and the physician in a therapeutic partnership. Instead of the doctor being the primary motivator in the patient's recovery, functional medicine or lifestyle medicine promotes more of a team effort. The patient takes on quite a bit of responsibility for their own recovery, with the doctor providing the therapeutic input. Functional medicine changes the focus from disease orientation to a patient-centered orientation. By shifting this traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person and not just an isolated set of symptoms. Further, functional medicine physicians spend time with their patients, listening to their stories, learning about their lives, and looking at the interaction between their genetic, environmental, and lifestyle factors that can influence the long-term health, and how the interaction of these things can create complex chronic disease states. Then putting together an individualized treatment plan to address the individuality or uniqueness of that specific patient's condition. In this way, then, functional medicine supports the unique expression of health and vitality for each individual. It's an evolutionary change in the practice of healthcare that better addresses the healthcare needs of our patients here in the 21st century, where chronic disease is exploding.
You are right about that. Let's talk about some of the considerations we discussed earlier that a functional medicine practitioner have in evaluating a patient. What was the first consideration we talked about? It was the GI tract, aka the gut, technical term. Dr. Volstad told us why the gut is so important to a patient's health, and even described for our listeners an important condition of the gut found in patients who have chronic disease, and that condition was called leaky gut. If you would, Doc, why don't you briefly refresh us with what that is and how it may affect a patient's health?
Sure, Laura. Leaky gut, that's a term that we used to describe the condition of a patient's GI tract where the permeability of the intestinal lining is changed. The lining of the gut allows things to pass through to the circulatory and or lymphatic system, and what happens in leaky gut is more things are allowed to pass through than should be. This then results in the body responding by increasing the activity of the immune system, and that's the key. When this upregulating of the immune system becomes chronic, the result can be a chronic inflammatory response, and we're going to hear more about that in today's show. It's this chronic inflammatory response that can be involved in the development of chronic disease so many people are suffering from. Things like multiple sclerosis, lupus, rheumatoid arthritis, and Sjogren's disease, just to name a few.
Well, to wrap up the review, Doc, I know we talked about how you can discover or uncover some of these issues by some simple testings, right?
Yep, yes, we did.
Yeah, that would include blood tests, urinalysis, saliva testing, stool testing, and some other lab tests that you might call for that are used in the evaluation of the patient who's seeking care from you. Does that sound about right, Doc?
Yeah, Laura, it does. You've done a good job remembering what we've discussed before. But I'd just like to add that these tests are standard testing procedures used throughout the healthcare field. It's just that we functional medicine practitioners read them a little bit more narrowly. What I mean by that is that the normal ranges that functional medicine practitioners use may be a bit more narrow than what a conventional Western medicine physician would use. And remember, it's all about homeostasis and balance.
Well, Dr. Word, I just heard homeostasis. Can you explain that one, Doc?
Sure, Laura. Homeostasis is the tendency of a system, such as our bodies, to maintain an internal stability or status quo, so that we don't have wild fluctuations in the way things work on the inside.
Okay, let's continue. This week we wanted to continue talking about the functional medicine approach to restoring health and vitality. Doc, can we talk about maybe a specific problem or condition that some of our listeners may be experiencing? Like kind of give them an idea of how functional medicine, aka lifestyle medicine, would approach their problem. What kind of solutions they might expect from that?
Can do, Laura. I thought this week we might talk about hypothyroidism. You know, that's a very common condition, and I know quite a few people are suffering from it. These are the patients that are on Synthroid or levothyroxine. If you've ever heard of those medicines and have friends that might be taking it, you know that they are suffering from hypothyroidism.
Yeah, I know we've heard of a couple of those drugs. Synthroid is one that you hear very commonly, but, you know, what is that treating really? Can you describe for our listeners what hypothyroidism is? There's a hyper and hypo, and then, you know, what is it? Where is it?
Before we do, let's talk about what the thyroid is and what it does. The thyroid gland is located in the anterior aspect of the neck, right behind the Adam's apple. So if you'll take your finger and your thumb, and if you're driving, don't do this, but if you're at home, take your index finger and your thumb and kind of straddle your Adam's apple in the middle part of your front neck and maybe move it from side to side. If you palpate or push in, you might feel a little bit of a softness. Well, the thyroid gland is located right behind that Adam's apple. So now you know where it's located. So what does the thyroid do? The thyroid is responsible for regulating how the body uses energy. It affects the body's rate of metabolism. It's also involved in the body's growth, and it also functions with other organ systems. But it's this metabolic function that we want to talk about right now. It's the function of how our body uses carbohydrates, proteins, and fats for energy. It also increases the consumption of oxygen in our body. All of these activities we just talked about are controlled by substances produced by the thyroid called hormones, the thyroid hormone or thyroxine. These hormones will enter the cells of our body and communicate with the DNA of the cell to affect the function and activity of that cell. In understanding hypothyroidism, then, it's important to know that the amount of hormone produced by the thyroid is very controlled and a very complex process, and it involves other glands found primarily in the brain.
Wow, that's a big job. So it's the hormone that's produced or not produced correctly that results in a patient developing hypothyroidism? Okay.
Hey, that's pretty good, Laura. And you're mostly correct. But there are two mechanisms by which a person can experience hypothyroidism. The most common mechanism is that the thyroid, for whatever reason, isn't producing enough hormone, so all of those activities that we talked about that the thyroid is involved in via the hormone are diminished. However, there is a second mechanism that has to be considered. These are the people who are in fact producing enough hormone, but because of problems elsewhere, specifically with cellular health, these people can't use the hormone appropriately and so have the same problems or symptoms as those who aren't producing enough of the thyroid hormone. So what are the reasons that people can develop hypothyroidism? There are a number of causes, but by far the most common cause of hypothyroidism, especially in women, is autoimmunity. Research is clearly demonstrating that the person's own immune system is attacking and damaging their own thyroid due to chronic inflammation. This is important to know in order to understand how to treat the condition, but more on that later. So people who have hypothyroidism may talk about being tired, feeling cold, gaining weight, having brain fog. These are just a few of the symptoms. There are a number of symptoms that can be associated with hypothyroidism.
Are there risk factors in the development of hypothyroidism? I mean, what type of or what kind of circumstances are there that may increase the chance of somebody developing hypothyroidism?
Absolutely, there are risk factors. Does a person already have an autoimmune disease such as lupus, rheumatoid arthritis, or multiple sclerosis? This is a big factor as it relates to a major cause of hypothyroidism that we talked about a minute ago. Another factor is lifestyle choices. Does one smoke? Do they avoid eating foods such as salt, seafood, seaweed, and or dairy products, as this reduces the intake of iodine? Does one eat a lot of raw broccoli, Brussels sprouts, cauliflower, kale, just to name a few? In these foods, there are compounds that have been isolated as causing goiters. These compounds are called thiocyanates, and these are made from phytonutrients called glucosinolates. And these types of substances are found in abundance in the cruciferous vegetables like broccoli and Brussels sprouts. The problem is these substances that I just mentioned seem to interfere with iodine absorption, and especially a problem when the iodine is limited in your diet. Other risk factors. Is there a family history of autoimmune disease or of thyroid disease? Then there are a few risk factors that are just for women. For example, have you been pregnant? Or have you had a miscarriage? And for just men, erectile dysfunction and being over 50. Remember, risk factors don't mean that you will get the problem. It just means that you have a higher risk of developing the problem than those that don't have these specific risk factors. So don't be fearful that you might develop hypothyroidism just because you have experienced some of these risk factors.
Wait a second, Doc. Before we go any further, I heard a whole bunch of foods mentioned here that are supposed to be really good for you, like seafood and seaweed, raw broccoli, Brussels sprouts, cauliflower, kale, or millet. I love those things. I thought they were supposed to be really good.
Well,
good
they
cancer
are.
fighters.
They really are. They are good for you, but you have to remember that the kale and the Brussels sprouts and the broccoli, those specific foods can interfere with the thyroid's ability to utilize iodine, which is very important in the production of thyroid hormone. So if you have an issue with thyroid hormone production, then you want to stay away from these foods because they can interfere with that. Does that make sense to you?
It does. It's just tragic from this cruciferous lover.
Well, the thing is that once you get control of your thyroid condition, then certainly you can add these foods back in, but they do need to be done on a somewhat limited basis.
I see.
Now, in relation to seafood is a great thing to eat if you have a thyroid condition because fish usually contains some iodine. So what they're talking about there is that people who don't eat seafood may have a tendency to develop a thyroid condition or exacerbate a thyroid condition because you need the iodine from the seafood.
Okay, I see. Thank you for clearing that up. Okay, so you also mentioned that these risk factors, you may have a couple of these here and there that you might develop hypothyroidism, but they're just that, right? Just risk factors.
That's correct.
Okay, so now let's say someone comes to see you and they suspect they have a thyroid problem based upon symptoms. What do you do?
What do you do? Well, that's a really, really big question, and I'll try and explain as best I can, but try to keep it somewhat brief so our listeners don't fall asleep out there. There are three things that you would do. You evaluate the patient, you make a diagnosis, then you create a treatment plan.
Well, that sounds simple enough.
It certainly sounds that way when you say it, but let me tell you, it isn't as simple as it sounds. So let's talk about evaluation first.
Okay, Doc, lead us through it.
Probably the most common thing in the evaluation arena that patients are familiar with is a blood test. Now, what should be included in this blood test? I've had patients come in with records from another physician's office for a blood test taken to evaluate their thyroid, and the only test that's recorded is a TSH test, or the thyroid stimulating hormone test. It is my opinion that you cannot accurately diagnose hypothyroidism just based on the TSH test. You really need to run the complete thyroid panel to have an accurate understanding of what's going on in the patient's body. That panel also needs to include a test for specific antibodies, specifically the thyroid peroxidase antibody and the thyroglobulin antibodies, as these are an indicator that there may very well be an autoimmunity issue ongoing in the patient's condition. Other markers you might want to look for in a blood test would be markers for inflammation, like C-reactive protein, for example. I think it's very important that we do a complete blood test on these patients before making a diagnosis of hypothyroidism, as we want to have a complete picture of what's going on in their body.
Oh, Doc, my eyes are glazing over already. Sorry. How do you know? That's a lot in a lab test. And you would think when you have a lab test to take, let's say for your thyroid hormones, that it would include everything. When they say the panel, I think it's all inclusive. How would you know that it isn't? That's
true, but a lot of times they don't order the thyroid panel. They only order the one test, the thyroid stimulating hormone test, or the TSH test.
Yeah.
And that's what I'm talking about. Sometimes, yes, they will order the entire panel, but more commonly than not, when I receive records from other offices, all it includes is the TSH test, and the patient is diagnosed as hypothyroid. And I just don't think that's a complete picture. We need to see everything. That's why I include all the other markers in what I do.
Okay.
The next major evaluation that I would do would be an evaluation of their GI tract. Remember, the GI tract is key in the general health of a patient's immune system. Remember when we talked about this a few weeks ago, we talked about how 70 to 80% of the immune system is in the gut. So if the gut is not healthy, how can we expect the immune system to be healthy? So GI evaluation is very, very important. Another step or aspect of evaluation would be the symptom questionnaire. That's probably the first thing that I would do, just to get an idea of what the patient thinks is going on with their body from a symptomatic perspective. These symptom questionnaires can be rather extensive, and as a matter of fact, the one that I use in my office can be as long as 18 pages. So don't be impatient if you're given a symptom questionnaire by a functional medicine practitioner, because it is important that you be as complete as you can in giving that practitioner your history.
Did you say 18 pages?
I did.
That's going way back, or holy cow, that's like, okay, first, I was born.
Well, you need to get all that information.
Wow.
Okay, we've done all the evaluations, so what's next? The next step is to then make the diagnoses. So based on the lab work and the clinical assessment of the physician, the diagnosis then can be made of hypothyroidism. Now the next big thing is treating the patient. How do you treat the patient who has hypothyroidism? Well, there are many, many considerations that you can use, maybe dietary and nutraceutical considerations, but let's be a little bit more specific. I think the first thing is treating the patient for chronic inflammation. This is a generalized treatment protocol and would include changes in dietary habits, maybe some nutraceutical supplementation, because we really want to resolve the chronic inflammation aspect of the patient's condition. Step 2 in treatment, or the second thing you could possibly do, would be to supplement the patient with iodine. Now, iodine is a really, really controversial issue, and it's all because of something that occurred in a year, I think, 1948, when two guys by the name of Wolf and Chaikoff did a test where they gave large amounts of iodine to rats and thought that it ended up causing them to have a lower production of thyroid hormone. Interestingly enough, that didn't happen. But for some reason, they still hypothesized that that would occur, and then they extrapolated that hypothesis to humans, and iodine fell out of vogue as a medicine in the medical community. As prior to that, iodine in the form of potassium iodide was a very popular medicine that seemed to help a lot of people with a lot of conditions. But because of this study coming out in 1948, iodine kind of fell out of favor. Interestingly enough, 1997, a guy by the name of Dr. Guy Abraham challenged this perspective and did his own research of about 4,000 patients, and basically what he did is he disproved the Wolff-Chaikoff effect. He proved that iodine certainly is not as detrimental to the human body as was thought, and is in fact very beneficial for patients who have some specific health issues. Things such as fibrocystic breast disease, bronchial asthma. Iodine decreases the need for insulin. It's been shown to help migraine headaches. It also has been shown to reduce the need for thyroid meds. It also has shown to reverse fibromyalgia. So iodine is a really, really important mineral that I think most patients need, not only just as a natural supplementation or a general supplementation, but also as a therapeutic agent. It's good to see that it's becoming more and more in vogue and showing the positive signs of helping patients who have specific diseases.
Okay, so iodine is back on the good list, but what foods can you get iodine from, or is it all supplementation now?
No, that's what we talked about a little earlier. You can get it in salt, as most salt is iodized. You can also get it from seafood. Remember, we talked about that.
Oh,
okay?
yes.
All right. Now, moving on, selenium. Selenium is another mineral that can be used to help with patients who have hypothyroidism. Selenium is involved in the synthesis or the making of thyroid hormone, and it reduces the antibodies to the thyroid peroxidase. 2 studies have shown that 200 milligrams of selenomethionine significantly reduces the antibodies to thyroid peroxidase. That's very important as it counteracts the autoimmunity issue with patients that may have that type of hypothyroidism. Mm-hmm. Another treatment that you want to provide is what's called a glandular. This is where they take actual tissue of the thyroid from an animal, most commonly a sheep or a cow, and process it into capsule form, and then the patient takes that as a supplementation. Another important supplement is the essential fatty acids, or EFAs. These are very important in the reduction of inflammation. They also help synthesize thyroid hormone. And then I believe that everybody should be on a multivitamin and mineral and a B complex. But those patients that have hypothyroidism especially need this support because those support the entire body. Now, we did talk about the health of the GI system, and if you remember our show a few weeks ago when we talked about the GI tract, we talked about the importance of taking a probiotic. Since the GI tract is so involved in the immune system and can be an issue with a patient who has hypothyroidism, we want to address that by giving them a probiotics. Now, an interesting sidelight here. There are products out there that can be substituted for the Synthroid or the levothyroxine.
Really?
The example is a company by the name of Biotics and their product called GTA. You can actually substitute this natural substance for a Synthroid or levothyroxine medication. There are dosage tables that compare how much of the GTA you need to take to equal the amount of Synthroid or levothyroxine that you're taking.
Huh.
Now, another interesting thing that needs to be done, especially to reduce the inflammation, is an alkalizing dietary change.
Yes.
And I know, Laura, you're really big on this. And if you would, just take a minute to talk about what an alkalizing diet is and what kinds of foods someone would eat.
Well, that's a whole nother show in itself, Doc. I mean, the books and books and books have been written about
That's true.
alkalizing diets, but boy, does it make a difference in your body. When we were totally alkalized, we had so much more energy and just felt so much better. You just don't realize. But some of the foods that you can eat to help alkalize would be all your leafy green vegetables, any amount of salad you want to eat is always good for you. Fruits, stick to lemons and limes. Some of the fruits that aren't as sweet, lemon, lime, and grapefruit. A great alkalizing.
Yes, they are.
Tip I'll tell you real quick before we have to move on is just to drink lots and lots of water, but in that water, squeeze a half a lemon or a half a lime, because it's very alkalizing to your body. And the adage is disease can't live in an alkalized state. So get your body alkalized. Lemon water, lemon water, lemon water.
So you're telling me French fries and pizza aren't on the diet to alkalize?
Not so much.
Broken hearted.
I know. Just get it out of the house and don't think about it.
Okay, and one last thing I want to mention that's important, I think, for anybody who has a health condition. If they're able to, they need to exercise, and then also they need to have a recreational or relaxation time. It's very important that we calm the body, and exercise will do that, as will relaxation and also recreation.
Boy, do we need to take that advice.
I'm telling you.
Find the time. Looks like there are a lot of things people can do to help themselves if they have hypothyroidism.
Yep,
Doc.
there are.
So, friends, if you think functional medicine might be an answer for your situation, we're here to help you. Remember, our address is 275 Tony Penna Drive, Suite 12, and our telephone number is 746-4242. Another programming reminder, as I mentioned earlier on in the program, the times our show is airing have changed. We have moved to 9 a.m. on Friday morning and 10 a.m. Saturday mornings. So please make a note of that change. And that about wraps up another edition of the Chiropractic Corner, Doc. Any last words before you move on to our tip of the week?
Yes, there are, Laura. Like I've said before, and I'll say it again, chronic disease is a food and lifestyle-driven situation that is influenced by environmental and genetic circumstances. New and different diagnostic approaches are required, like delving deeper into blood tests, utilizing saliva testing and urine and stool analysis, and then that new kid on the block, epigenetic testing.
Ooh, the big word.
This new approach is utilized by our office and other functional medicine practitioners for the evaluation and management of chronic disease conditions. It's the functional medicine that uniquely integrates what is known about how the human body works, adds in the information gathered by diagnostic testing, and then with an individualized, patient-centered, science-based treatment plan, attempts to treat the underlying cause of chronic disease. Functional medicine is indeed a healthcare system appropriate for the challenges of the 21st century.
Thanks, Doc, and I'm hopeful our listeners will take advantage of this new approach for their own benefit or for the benefit of a friend or a loved one. Now for the tip of the week. Iodine. Love it or hate it, good or bad. It seems based on comments made earlier that's become a vastly maligned and underused mineral that has many health benefits. So our tip of this week is to suggest that you consider iodine as part of your health habits. It comes in many multi-mineral formulas, so if you have any questions about the vitamins or supplements you take or think you should take, drop us an email at iamcairo1@gmail.com. And remember, our phone number is 746-4242. We'd love to hear from you. That wraps up another edition of the Chiropractic Corner. Thanks for joining us, and remember, be well, live well. We'll see you next week.